So this is 8-year-old child, and this is how he presented to Maulin with shortening, severe varus at the neck, with probably pseudarthrosis at the neck, and what he question he had in mind, what intervention and how to fill the gap within the neck region, and how to plan the correction and which implant to use. Again, a problem in a pediatric hip of this type. And he did an X-ray in maximum adduction, because that is what we do to plan this procedure. That is how we want our hip to be. This also gives an idea whether in this position, if there is a hip instability, and any additional acetabular procedure if needs to be done. So he planned for a femoral procedure, according to Powell's principles, and along with the subtrochanteric abduction translation osteotomy. So it's an angular translation osteotomy which he has done. He also did a fibular graft to fill in the gap, and this is 6 months follow-up, which shows that it's healing well. Maybe there is some subluxation of the hip or uncoverage of the head because of the valgus, but you can see at 1.5 years follow-up, this is the picture, and these are the functions of the patient. And he feels that, of course, this child needs to be observed further for limb-length discrepancy and hip dysplasias. But the aim of correcting this very severe varus and giving a mechanical better alignment to the hip was achieved in this case. So thanks, Maulin, for sharing this case.